Hello, my name's Julie McCrossin, and welcome to this series of conversations with people who are working to improve access to clinical trials for everyone in the community. And this series is hosted by the GI Cancer Institute. In this episode, Dr. Abhi Pal, medical oncology staff specialist at Liverpool Hospital in southwest Sydney, is talking to us about the cultural and language characteristics of the people in his community and the three key reasons why their inclusion in clinical trials is vital. Because we'll have a national and indeed an international audience here with New Zealand and beyond, I just want to give a few quick facts about southwest Sydney where you're working. Over 1 million people live in these suburbs. It's substantially expected to grow over the next 20 years with a very significant birth rate. 43% of the current population are born overseas. And in 3 of the major local government areas in your area, the speaking a language other than English at home goes as high as 75%, and you have higher hospitalisation rates than the rest of New South Wales. So, boy, this question almost seems superfluous. The 3 key reasons you've got to improve inclusivity.
So the first reason is equity in access, to ensure we have the same type of care for all Australians. It's part of the Australian Cancer Plan. It's part of the New South Wales Cancer Plan. There is a commitment across all levels to ensure equal access. So we need to find ways to make sure that we get good representation for all of these patients. The second reason is also about cancer clinical trial validity. So cancer clinical research is about ensuring our results are generalizable and valid for all populations. So when we systematically don't include particular populations in these trials, we actually don't learn about them as well. And so that's going to prevent, when we get these phase 3 results, we actually don't know how they operate in different diverse populations. And we already know from the data that different populations have pharmacogenomic differences, cancer genomic differences. Humans are different, and so that's really important. And finally, the key reason is also a broader effort about research literacy and health literacy. Cancer clinical trial access is one symptom of a much broader problem of healthcare access and equity. So this area of Australia that I work in, where there is intersection with poor literacy, low socioeconomic status, low rates of private health insurance, high rates of disability, high rates of humanitarian settlement, there is a cluster of factors that actually affects these populations at every level. And research has shown when we improve trial access, we improve other outcomes. So in the effort to enhance research literacy, we actually help better health and better engagement in health. So research is not just research, it's also about how do we get people to engage in healthcare. So equity, generalizability, and also a broader effort at health and research literacy.